Start again. Hello everyone. I'm Madeleine from Charles Sturt University in New South Wales, Australia, and today I'll be discussing my research on a major risk factor of poor reproduction of dairy cows, endometritis. This map is pointing out the town of Wagga Wagga, which is where I studied. Wagga is within a region called the Riverina, which is where my research took place. My research investigated the impact of clinical endometritis on the calving to conception interval of dairy cows. As most of you will know, a calving to conception interval is the period between a cow's calving and the date of their following conception. Dairy farmers attempt to minimise this interval in order to optimise economic gain. As the calving to conception interval becomes longer, costs increase in the following ways: reduced milk yields, reduced number of calves for sale or as replacement heifers per reproductive lifetime, reduced total lifetime productive days of each cow, increased breeding expenses through insemination, hormones, labour costs, etc. if conception rate is down, and higher culling rates if farmers are trying to stick to a tight calving period. So does endometritis extend the calving to conception interval? The findings vary greatly in the literature due to differing definitions and diagnostic methods over time. There are a few studies with definitions and diagnostic methods that were similar to our study, and they found that clinical endometritis extended the calving to conception interval by 32, 8 to 18, and 42 days in these three studies from 2002, 2007, and 2017. So the answer is yes, but by such varying extents. We wanted to find out whether or not endometritis was a problem for our dairy farms in the Riverina of New South Wales and whether we needed to be worrying about it and addressing this issue. So the two main aims of our study was to determine the proportion of clinical endometritis in the Riverina. It wouldn't matter if it affects reproduction if it was hardly there. And then to investigate the impact of this clinical endometritis on the calving to conception interval in this region. Based on opinions from vets doing regular reproductive visits in the area, the proportion of clinical endometritis was estimated to be about 7%, just as an anecdotal estimate. And we hypothesised that clinical endometritis would extend the calving to conception interval. This was a retrospective study that looked at records collected during fortnightly veterinary reproductive visits on 3 year-round pasture-based dairy farms in the Riverina for just over 2.5 years. The veterinary reproductive visits were performed by 3 different vets and involved identification of any abnormal reproductive tract discharge to diagnose cases of clinical endometritis and pregnancy diagnosis. Altogether, the study ended up including 659 cows and 977 PCMPs. Now, just to explain this acronym, a PCMP just stands for post-calving monitored period. Each cow would have a calf, was checked for endometritis, was inseminated, diagnosed for pregnancy, and then the cycle would start again. And each one of those lots was called a PCMP. It's an important concept because when determining the proportion of clinical endometritis, it was firstly out of how many cows, and then it was out of how many calvings or PCMPs. There was a post-calving discharge check at 30 to 40 days postpartum, and a pre-breeding discharge check at 50 to 60 days postpartum. The pregnancy diagnoses were done at about 30 days in calf and then again at 60 days. And the calving to conception interval was determined by the days between calving and the insemination date associated with the first positive pregnancy diagnosis. Our definition of clinical endometritis was based on a paper by Sheldon et al. 2006, who has attempted to pull together a universal definition, and as a previous speaker mentioned, it is difficult to find exact definitions of both subclinical and clinical endometritis, but we used the one from Sheldon et al., and it was any purulent uterine discharge detected per vaginum with a gloved hand more than or equal to 21 days postpartum, or mucopurulent discharge after 26 days postpartum. So after calving, by 21 days, a cow shouldn't have any more purulent uterine discharge, and after 26 days, there shouldn't even be any more cloudy discharge. And here we just have a table showing how we scored the reproductive tract discharge using this definition. Cows diagnosed with clinical endometritis were given an injection of cloprostenol if a corpus luteum was present, and this was repeated in 1 to 2 weeks. And the cows then had fortnightly rechecks, and treatment was repeated if the discharge was unresolved. Other than the discharge and pregnancy diagnosis findings, other data collected on farm for each PCMP, either during the farm visits or from farm records, were cyclicity status by presence or absence of a corpus luteum, body condition score, presence of any periparturient disease, such as ketosis, hypercalcemia, LDAs, lameness, and so on, parity, peak milk yield, and mean maximum daily ambient temperature in the previous month to conception for each PCMP. In order to determine the relationship between endometritis and calving to conception interval, we had to investigate the other influences of calving to conception interval found in the literature to see how much endometritis had a direct impact on calving to conception interval and how much was via intervening variables as well, or a total effect on calving to conception interval. So this confusing-looking diagram here is called a directed acyclic graph, and was produced using a software program called Daggity, which takes potential causal pathways and links between potential risk factors of calving to conception interval, including endometritis, and calculates the minimal variables that need adjustment in order to determine the total and direct effects of endometritis on calving to conception interval. Endometritis is the exposure variable, and calving to conception interval is the outcome. The greeny-yellow variables here are the risk factors for endometritis. The blue variables are risk factors for calving to conception interval, and all the red variables are risk factors of both endometritis and calving to conception interval. The green pathways indicate causal relationships, and all of those red pathways indicate potential biasing pathways. So once all that was calculated through the program, the variables requiring adjustment for the total and direct effect of endometritis on calving to conception interval were as follows. These variables listed here. So our results. The proportion of PCMPs with clinical endometritis was 16%, and the proportion of cows with clinical endometritis was 22%. So this was higher than the 7% that we had initially estimated. The different proportions between farms were not statistically significant. This is a Kaplan-Meier survivor curve. It portrays the probability of remaining not in calf over time after calving. The blue line represents PCMPs without endometritis, and the orange line represents PCMPs with endometritis. And the shaded areas represent the confidence intervals of each. So here you can see that cows take significantly longer to become pregnant if they have had endometritis, a median of 176 days compared with 118 for those without. And the results were significant with a p-value of less than 0.0001. A Cox regression analysis was performed in order to determine the effect of all of these variables on the left here, as determined by the directed acyclic graph on calving to conception interval. Here you can see that the total effect of endometritis has a hazard ratio of 0.62, meaning that endometritis decreased the rate of pregnancy and calving to conception interval was increased by approximately 0.6 times. The total and direct effects of endometritis were similar, which shows that the lower pregnancy rate of the cows with endometritis in this study was mostly a direct effect of the actual endometritis. In terms of other variables, high parity and high peak milk yield both had significant effects on the calving to conception interval, which is supported by the literature. So this study has found the proportion of clinical endometritis in the Riverina, which, as I said, was the 16% of the calvings or PCMPs and 22% of cows. This reasonably high level of endometritis is consistent with other studies found in the literature. However, the proportion of endometritis does tend to vary widely depending on location, definitions, and diagnostic methods. In this study, the proportion of endometritis did not differ significantly between farms, suggesting that this level of clinical endometritis may be consistent in other farms with similar climates and management. The calving to conception interval was significantly extended in PCMPs with endometritis compared to those without. It was a 58-day increase, which is about 49%. Due to the retrospective nature and the commercial nature of the farms involved, we didn't have a no treatment group. The findings are still useful, however, because it demonstrates that despite this veterinary intervention, endometritis is still having a significant impact on the calving to conception interval in these herds. This effect of clinical endometritis extending the calving to conception interval is consistent with the literature. As mentioned before, we had the numbers like 32, 18 and 42 days, and the increase of calving to conception interval in our study was even higher than this with our 58 days. We'll skip that one. So in conclusion, there is a high but relatively normal proportion of clinical endometritis in the Riverina of New South Wales, and it is dramatically extending the calving to conception interval. This reinforces the importance of reproductive management of dairy cows in the periparturient period in these herds and encourages farmers to increase efforts to minimise the risk factors of endometritis, such as dystocia, retained fetal membranes, negative energy balance, etc. It may instigate farmers and researchers in other areas to find out their herd's proportion of clinical endometritis to determine whether it becomes a focus on their farm, and considering that demonstrated effect on the calving to conception interval. So it's our hope that this information will encourage further surveillance and prevention of clinical endometritis on other dairy farms around the world. More research is required to know more about the various treatments of endometritis. Studies in the literature are of widely differing study designs about very specific facets of treatment, so some more randomised control trials and meta-analyses would be beneficial. And also for the prevention of endometritis. Risk factors for uterine infections are well established and we can work towards minimising those. However, programs for the prevention of this uterine disease development are not. It would also be useful to understand more about the role of the immune and endocrine systems in endometritis. A big thank you to my supervisors from Charles Sturt University, Alan, Vicky and Angel, and thank you for having me and thank you all for listening.